So joining me now from his home in Winnipeg is Marty Gold. He's an independent journalist and a good friend of the show. Marty, I wanted to have you on because Manitoba from the very beginning has been sort of going against the grain when it comes to the coronavirus. When we saw other jurisdictions like Ontario and Quebec and to a much, much lesser extent, Alberta, doing coronavirus enforcement and these massive fines, Manitoba was moving towards education. And I think you found a lot more compliance because of that.
Well, the situation here was very interesting in that we I'll look at the stats as we tape today, and
Sure.
just give me a second to pull up my whatever Twitter window I had this in, courtesy of Scott Billick. I'll make sure to mention him. I follow Scott's. He's at always at the press conferences, the provincial press conferences, and also when there's they've eased off on the those kinds of things now that certain days they just put out a notice. So here's the Manitoba stats. We'll go off of this. The total remaining 0 new cases, total remaining cases 292, 16 active cases, 7 deaths. I'll go through those in a second. There's currently 0 hospitalizations and 0 in intensive care, 269 recoveries. So that's 269 recoveries and 7 deaths out of 292 total cases. They did about 400 tests on Monday, and there's been just under 40,000 tests done total. Now, it's a very small sample size for a population of 1 million, but the number of total cases is ridiculously low here. And the deaths, and Scott helpfully always reprints this, man in his 70s, woman in her 80s, 2 women in their 60s, and then 3 other men in their 50s, 60s, and 70s. So we have no deaths under the age of 50. I remember that a number of these cases had pre-existing conditions. Some of these people were already in rough shape. But we've had almost no effect in terms of casualties and the number of cases. As I think you and I have discussed previously, this is in no small measure because we are so isolated here. We did not have the volume of traffic, air traffic in particular, that would have come from Iran or China. Yeah. And so we didn't have the spread. And as you mentioned, the government here was very big on education. They essentially locked down. I'm going to turn that off because somebody thinks I'm very popular today, and I'm not interested in them for now. The population here, honestly tends to be kind of compliant with these things. We did not know what we were dealing with, but one thing that I think a lot of Manitobans recognized was that if this wasn't kept under tight controls, that we could end up with an influx, especially from places that don't have, when you think of a crowded place that doesn't have, access to water and hygienic living environment, it would be the numerous, especially northern Manitoba, Aboriginal First Nation communities. And so I think there was a very real and very legitimate fear, including among the Aboriginal leadership, that they could end up quickly with something that got way out of hand on them and cause a lot of tragedy. And we were fearing that. But Manitobans, there's been, without discussing the moral standing of these kinds of things, there's been very few fines handed out, very few shops or restaurants, or there weren't even any. There might have been like one restaurant where customers were coming onto the property that weren't allowed to access under the Manitoba emergency conditions. Manitobans are, I think, very often a polite, compliant bunch. But Manitoba and Saskatchewan in particular, I'm not so familiar with the numbers from the Atlantic provinces, but the numbers here have been very encouraging. We did not have any kind of an overwhelming of the emergency rooms. In fact, here as well as in other jurisdictions, there was a concern that people had stopped going to see doctors, stopped going to hospitals for, if they were having, the hypothesis was people could be having mild stroke symptoms, and Manitobans a number of us are often famous for, it's nothing, and sometimes it's more than nothing. So we didn't have any strain. There may have been strain on the staff in some of the hospitals where these cases were appearing, but no overarching theme of a crisis in the healthcare system has emerged here. Business-wise, we are certainly suffering casualties. Very well-known restaurants are falling by the wayside by very accomplished chains. A lot of the mom-and-pop type shops, small coffee shops, are obviously struggling when they couldn't have customers in.
If you'd like to get access to my show, as well as other great TV-style shows too, like Ezra's Nightly, Ezra Levant Show, and David Menzies' Friday night show, Rebel Roundup, just go to rebelnews.com/subscribe. That's rebelnews.com/subscribe.